This responding to symptoms lecture is going to focus on musculoskeletal conditions and pain. The aim is to give an overview of common pain disorders that you will see coming into the community pharmacy. So hopefully by the end you'll be able to describe appropriate management of different types of pain with over-the-counter products and also non-pharmacological interventions. Be able to ask patients the appropriate questions to help you diagnose the problem and also differentiate between different conditions and more serious conditions that need referring. Pain is a highly unpleasant and physical sensation caused by illness or injury, and it's very subjective. Everyone has a different pain threshold, so for some something might be only mild in pain, whereas for others much more severe. Pain, obviously you can't see it. It's not like somebody coming into your pharmacy saying they've got an eye infection or a rash that you can actually have a look at. So it's good to get into the habit of asking people to explain the pain that they're experiencing and try and describe the type of pain or what they're feeling. There are three main types of pain. Nerve pain, neuropathic. This is where there is damage to or disease to the nervous system, causing like a shooting or burning pain. Organ pain, this or visceral pain is from activation of receptors in the thoracic, pelvic and abdominal organs. They're highly sensitive to stretch, ischemia and inflammation, but insensitive to stimuli such as cutting and burning. It's often described as a vague pain, like an aching or a pressure. Body pain is where receptors are activated in tissues such as the skin, muscles, skeleton, joints and connective tissue, and this is often described as a cramping or gnawing pain. So some examples of different types of pain: dental work, pain after being burnt or cut, labour and childbirth, obviously a very severe pain, and pain due to any injury, so it might be a sports injury, broken bones, or from something like an animal or insect bite. Pain after surgery and also headache. Pain can be acute or chronic. Acute tends to be where it begins suddenly, and it's usually a warning sign of disease or threat to the body. So something like broken bones or dental work being done, cuts, burns. Chronic pain persists after the injury has healed and can go on for some time. Pain signals can remain active in the nervous system for weeks, months or years. This table just gives a nice little summary of the differences between acute and chronic pain. So the sort of medications available to treat pain come under three different classes. So you've got your non-opioid analgesics, such as paracetamol, your non-steroidal anti-inflammatories such as ibuprofen, naproxen, diclofenac and aspirin, and these work by inhibiting cyclooxygenase enzymes. And then there's your opioids, which are obviously a lot more stronger, including codeine and dihydrocodeine. So there are many different types of preparations available to buy over the counter, and they come in all sorts of different forms. These are prescribing guidelines written by NICE, and they're what we call CKS or clinical knowledge summaries. So you'll get to see a lot of these over your time during the course, and they're nice summaries written for treatment over lots of different conditions. So this is a step-by-step approach of how to manage pain, starting obviously with the lowest step and building up to step 5. And it works by starting off with paracetamol and then substituting other medications or adding in other medications where necessary. It's important to note that these are general prescribing guidelines, so not all the preparations on here will be available over the counter. Also, when looking at different doses within the BNF, obviously the BNF again is prescribing guidelines, so they may not necessarily match the dosing guidelines on the products that you sell over the counter. So it's always best to double check your over the counter products, to double check what dose you can sell those medications at. So we'll have a look at our paracetamol first. There are lots of different brand names and it is impossible for you to know them all. As long as you actually know the actual drug name or generic name, you'll be able to advise your patients on the preparations that are stocked within your pharmacy. Obviously they all come in different forms, so here we've got tablets, we've got sachets, we've got liquid, so you can advise on a particular formulation that will be best suited towards your patient. The action of paracetamol is not fully understood, but side effects are rare, which is good. You need to counsel patients on the maximum dose. A lot of cold and flu remedies actually contain paracetamol, so you need to make sure that patients aren't doubling up and overdosing. As I said, lots of these medications, they come in all different formulations. So there are tablets, capsules, soluble tablets, liquid and suppositories available. It works by, as well as working on pain, it also reduces fever as well. Now it's quite common for paracetamol to be used as a suicide attempt, although not many people die from it, but it can cause long-lasting liver damage. And I've seen quite a few patients who've come through the admissions ward into hospital who have taken overdoses, and some of those do go on to have long-lasting liver damage. So there are restrictions on the amount of paracetamol you can buy over the counter and within the supermarket to try and reduce the risk of that. Ibuprofen is a non-steroidal anti-inflammatory medication that is available to buy over the counter. Again, there are lots of different formulations. Some people do find tablets difficult to swallow, and if that is the case, you can often advise that they can try a caplet or a capsule instead, because they're more rounded, they're easier to swallow, or there are liquid preparations as well. Ibuprofen has the added benefit of being anti-inflammatory as well as an analgesic and antipyretic. The dose for children will depend on age, and there are some side effects, the most common being GI disturbance. We therefore recommend patients take this with or after food to try and reduce the effects of this. There are quite a few cautions, so ibuprofen and other non-steroidal anti-inflammatories can cause fluid retention, which can make things like heart failure or hypertension worse, and therefore they are cautioned in cardiac disease. They can also affect the renal function. They can cause hypersensitivity in asthma patients, and also there has been a link between causing flare-ups in ulcerative colitis and Crohn's disease. So you need to bear this in mind and get a full history from the patient before you recommend it. Aspirin was the first non-steroidal anti-inflammatory drug available. So it comes in different strengths. So there's a 75 milligram strength and a 300 milligram strength. So the 300 milligram strength is the one that's generally used for pain relief, and the 75 milligram is used for blood thinning and not for pain. Like ibuprofen, aspirin is a non-steroidal anti-inflammatory, so it has that added benefit of being having the anti-inflammatory action as well as being an analgesic and antipyretic. There are more cautions than with ibuprofen, and in particular we need to be careful with patients with coagulation defects, GI ulceration and kidney impairment. It cannot be used in children under the age of 16, and that's because it's been shown to increase the risk of Ray's syndrome. And this syndrome that can cause brain swelling and liver problems, which can lead to death. It also causes GI irritation, so again we need to recommend that it's taken with or after food. They can be sold over the counter in packs of 16 or 32, but if a patient does request more than one box, it can be sold at the pharmacist's discretion. This has been taken for the Medicines Ethics and Practice Guide, and this document gives guidance on legal aspects of pharmacy, and this is an important resource that you'll become more familiar with during the course and also as you practice as a pharmacist. There are legal restrictions over the quantities that you can sell over the counter for paracetamol and aspirin, and it's important that you become familiar with these. Larger quantities are available and can be issued on prescription, but for selling over the counter, you need to be familiar with the restrictions that are in place. Mild opioids are available to purchase over the counter, and these are as combination products either with paracetamol or ibuprofen. So these combination products do contain low doses of opioids, but even so there is risk of misuse. We therefore say that patients should not use them for no more than 3 days, and if you do have a customer coming in regularly to buy these products, you can actually refuse to supply and recommend that they see their GP, who can review them and prescribe them on prescription if needed. Mild opioids only have an analgesic reaction. Again, they're available in lots of different formulations, so you need to check with the patient what is the most suitable for them. They're not recommended in children under 12, and they only have about 8 to 10 milligrams of codeine per tablet. Care needs to be taken in a lot of different conditions, so things like asthma, COPD, liver impairment, so you need to check the patient's history carefully. There are several side effects, and these can be more common in the elderly, so constipation, nausea, and also drowsiness. If drowsiness does become an issue, then the patient should be advised not to drive or operate any machinery. It's important to be aware that caffeine is an active ingredient in many analgesic preparations, and it has been shown to enhance pain relief. They're available in many different combination products. So caffeine can improve the absorption of paracetamol by lowering the gastric pH, and generally the amount of caffeine that are in these preparations is equivalent to about what's in a cup of tea or coffee. Now they are a stimulant, so there is risk of misuse, and it's best to advise that they avoid these preparations before bedtime because they can cause sleep disturbance. I just want to take some time now to consider what you would identify as high-risk patient groups that are likely to present into your pharmacy, and then we'll go through that in the next screencast.